7 signs you have schizoid personality disorder. Schizoid personality disorder (SPD) is characterized by extreme social detachment, emotional coldness, and a preference for solitude. Unlike social anxiety, which stems from fear of judgment, people with SPD simply do not desire close relationships. Here are 7 key signs that may indicate you have SPD. 1. Prefer solitude. If you actively avoid social gatherings and prefer to be alone, this could be a sign of SPD. Unlike loneliness, which can cause distress, solitude for someone with SPD is a choice, not a burden. They do not crave social interaction or feel a need for companionship. 2. Limited emotions. People with SPD rarely express strong emotions like excitement, sadness, or anger. Even in situations where emotional responses are expected, they often seem indifferent. This emotional flatness can make them appear distant and feeling, or uninterested in what's happening around them. 3. Lack of close relationships. Unlike most people who seek companionship or intimacy, individuals with SPD do not feel a need for close relationships. They may interact with coworkers or family when required, but rarely initiate deeper connections. Unlike avoidant personality disorder, which involves fear of rejection, SPD is marked by lack of interest in relationships altogether. 4. Indifference to praise or criticism. Most people feel happy when praised and upset when criticized, but individuals with SPD feel indifferent. Compliments do not boost their self-esteem, and criticism does not bother them. This emotional detachment can make it difficult for others to connect with them. 5. Minimal interest in activities. People with SPD often struggle to find hobbies or activities that genuinely excite them, while others have passions or interests. They may feel a general lack of enthusiasm and only engage in activities out of habit, not enjoyment. 6. Detached from reality. Emotional detachment is a core characteristic of SPD. While not as severe as schizophrenia, individuals with SPD may feel disconnected from life, as if they are mere observers rather than active participants. They may have a rich inner world but struggle to engage externally. 7. Struggle with social norms. Small talk and unspoken social rules often feel meaningless to people with SPD. They may understand social interactions logically but fail to see their purpose. This can make them appear aloof or uninterested, which may lead others to misinterpret their behavior. Final thoughts. Unlike introverts, who enjoy some social interaction but need time alone to recharge, people with SPD have no desire for social connections at all. They are not lonely. They are simply uninterested in forming close bonds. While SPD itself is not harmful, it can create challenges in work and social settings where interaction with others is expected. Therapy can help individuals with SPD navigate social situations more effectively if they choose, but many do not feel the need for intervention. If you relate to these signs and feel that they impact your life, consider speaking with a mental health professional for further evaluation.